Welcome back to Tales of Truth, where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is JoJo, veterinary nurse extraordinaire. And today I have a ranty episode, and I'm going
Me
to talk
too.
about things holistic veterinarians say or do that irritate me.
Dangerous topic.
I know, and I'm going to be kind-ish, but I'm going to let everyone know how I feel about it, and we won't name any names, but
And remember that you are in the camp of holistic veterinarian. So,
I
I mean,
know.
if we're talking about truth in veterinary medicine, this is the unveiling.
This is the unveiling. Yeah.
And if you're
Um,
listening to us, you probably have seen a lot of this because you probably follow
yeah.
the camps of holistic veterinarians on socials or wherever you find them. Trying to work on completing my sentences.
Yes. JoJo and I are both tired today, but sentence structure and formation might be lacking, but you'll get the idea. Okay. So I came prepared today. Usually we don't prepare ahead of time, but this topic bothers me so much that I wrote a list of the things that irritate me.
Okay, which one are you gonna kick us off with? What bothers you about holistic veterinarians and what they say
Ah!
or do? Number 1.
Number one, vaccines last a lifetime. I cannot stand this sentence because there's so much that gets lost here for one. And it's just not even true. Some vaccines might last a lifetime sometimes, but you cannot compare every vaccine technology to the different viruses and spirochetes or bacteria that we're vaccinating against and make blanket statements like this. It irritates me. And yes, do I think historically, and maybe it's still happening present day, that we over vaccinate? Sure, that is true, but we do not need to swing the pendulum the other way and start having all these false claims. And so,
Right. Well, what goes beyond that, if I can interrupt for a second, you're using the word irritate, but what I hear is that is a dangerous rhetoric.
yes, it's dangerous. Yes, thank you for saying that. And so that
Mhm.
makes me mad
There
because
you go.
then then my clients, the people that are hiring me or pet parents everywhere are under this false pretense that vaccines last forever and that veterinarians are just, selling snake oil. And it just creates all this mistrust instead of just understanding what's happening. So
Mm.
I'm just going to give like the quick rundown. The immune system often makes longer immunity, like it lasts longer for viruses. Bacteria and spirochetes, the immunity, the memory does not last as long. So when people say leptospirosis is given every year, leptospirosis vaccine, it needs to be given every year. And so it's just not true that you give one and it lasts forever. Now, it is possible that you could give a cat, like a 1 or 2 year old cat, a panleukopenia vaccine, and that might truly last a lifetime. But
Mhm.
likely the rabies vaccine you gave your 2 year old dog is probably not still protective at 10 years of age. And I can say that because as an integrative veterinarian, I run so many titers that I feel pretty confident that the likelihood is low. If I were in Vegas, I would not bet on it. And so this idea that you vaccinate once and we're good for life is just not true. So
Okay. Heard.
check. Don't think that that's what's happening. It's not actually true. The second thing that people say that irritates me is not about vaccines, but it's about flea and tick prevention.
Mhm.
And we have a newer class of flea and tick prevention, like Brevecto, NexGard, Simparica Trio, all of those that have a different agent in them that is correlated with neurological conditions. Like some dogs will have seizures because of this medication. So that is true. But if you live in Connecticut and you're trying to prevent your dog from having Lyme's disease, from all the ticks that are, I don't know, it feels like they're all carrying Lyme's disease in Connecticut, but I don't live there. So that might not be true.
No shade on Connecticut.
No shade on Connecticut, but you guys have so many ticks. It's
So many
ridiculous.
ticks.
I don't understand why we can't have the conversation of the pros and cons. Yes, this medication might have this side effect, and here's what we know about it, and here's where I think it's safe. And that is such a better conversation than never use that. Because, if you're like, I'm going to go backpacking with my dog and I don't plan on using flea and tick prevention, or I'm just going to count on some essential oils to prevent Lyme's disease, please understand you're likely going to have a dog with Lyme's disease at the
Right.
end.
Well,
And if that's okay with you, then do that.
and transferable. I mean, you're bringing those ticks in the home. You're now
Yeah,
exposing yourself as well.
totally. Yes. And so while I think it's important to talk to people about those side effects and, informed consent, it's a very low percentage that happens. Knock on wood, it's never happened to me. But I think these sweeping statements are so unfair.
Right. And I will tell you from a consumer standpoint, I have felt shame and guilt that I work in holistic medicine and I use those medications on my dogs.
Right.
So it's very deep reaching, the damage in the lack of dialogue, as you said.
Right. Yeah.
Right. And I don't live in Connecticut or Florida or the South where
And as the earth warms up, we have more parasites. I've seen more ticks this calendar year than I ever have in my entire life in
yeah.
practice. And that hasn't, that's new. And so I just feel like we need to understand that fleas and ticks mutate and they become resistant to our medications. And I promise you, there is probably corruption in the pharmaceutical industry, but it's not at the level of your dog or cat's flea and tick prevention. And
Right.
so,
And I do think that is the one place that people are constantly looking for holistic alternatives to those medications.
yes,
And it may be that there's a black box warning on it, but also just, again, sweeping statements. That's what you're calling it. When we do sweeping statements, we shut down the dialogue or the conversation.
right. And it's important to understand what might be right for your dog. If you have a 7-year-old golden retriever that has epilepsy, yeah, we're not going to prescribe those. We're going to use something else. But, if you have a 2-year-old Labrador retriever that's out with you all the time and you do live in the Northeast, I think you should know the pros and cons.
Right.
So,
Okay. That was
okay,
number 2.
that was number 2. Number 3.
Are you nervous about number 3? Is that
No,
what the exhale was? What's happening here?
I can feel the rage. It's the years of rage. The idea that you're going to prevent heartworm disease by keeping your dog healthy. This is something that's been thrown out there by
Uh,
holistic veterinarians. And I just have to take a deep breath even saying that. The idea is if they're just healthy and their gut's healthy and their immune system's healthy, they should be able to fight it off. And
mm,
oh my gosh, but then we breed all these dogs that have all these problems. And we're like, if we just feed them a raw diet, they won't get heartworm disease. And
Or isn't
that,
there a don't they? I think I've seen supplementing with garlic. Is it garlic?
I don't know.
I mean,
Garlic's
I've
not
seen
as
that
good.
uh, uh, across the holistic channels. I'm like,
Yeah.
at this point, we can keep away vampires. We're what else can we promise?
Oh my gosh, I'm so irritated by this. And because heartworm disease, one is fatal. I mean, it's not uniformly fatal. I have one dog in my practice that is fighting for her life right now because a rescue organization refused her treatment for her heartworm disease. And now she's reached an end stage in her heartworm disease, and we're trying to kill the worms before they kill her. And it's terrifying. And heartworm disease can be prevented with ivermectin. I mean, a microdose of ivermectin. So if you live in the South, then it's so easy to prevent it. And I don't understand why you would die on the hill that I don't want to give my dog a microdose of ivermectin, but I'm going to leave them open to this nasty infection of worms
Mm,
living in their heart. There are actual worms in their heart,
clogging up their heart.
clogging their heart.
Yeah. It's a disgusting why do we have to talk about parasites? Ugh.
I know
But
you hate them.
also just well, I mean, if you've seen heartworm, if you've ever dissected a heart that has heartworm, it is so foul. And
Yes.
the idea that your dog is having to slow down in life. I mean, this happens to young dogs and they're having to be crated for months. I mean, and the treatment is so toxic, as you've said before
Yes.
on previous episodes. So and for those who are really concerned about the heart guards and the ivermectin plus, right? They have another ingredient typically in the preventatives. You can compound ivermectin to be a single ingredient. I mean, we can again dialogue.
Again, dialogue. Yes. I
Yeah,
wouldn't worry about the other ingredients because they're also extremely safe. But if you are just wanting to prevent heartworm disease, it's ivermectin and
yeah.
and
Okay. Well, I felt your rage
yeah,
in
this is
that one.
this is
It's
an
just so
angsty episode.
irresponsible. And
Yeah.
oh, yeah, I know one of your other ones on your list, and I can see how all of these are going to segue into it.
Yes, this last one.
Is this
Well,
your last one?
there's kind of two. Okay.
Okay.
The next one on my list is when veterinarians, and there are veterinarians that I know and love that say this. So I know and love you as a person, but when people say kibble or vaccines, interchangeable here, cause cancer, I want
Mm,
to just fall out of my chair. I'm so mad. Like I just want to throw myself on the floor and have a tantrum for so many reasons. One, I've been practicing long enough to see dogs eating Bill Jack. Oh my gosh, no shade to Bill Jack. But whatever, the lowest, cheapest, tier brand that you can find. And if that's what you're feeding, no shade to you. It's not causing your dog cancer. And that have done every vaccine ever recommended to them, and their dogs live to 15. Like if
mhm,
you've been practicing for any length of time, you've seen that. And then you've seen the dog that's fed raw, that's maybe never been vaccinated or minimally vaccinated, get lymphoma at 2. And
mhm,
at the end of the day, I do think diet's important. I'm a huge supporter of diet being such a pillar of health. And so that is true, but it is also true that so much of the cancer we see in cats and dogs is genetic. And you might not be able to prevent it, which people don't like to hear because we want to feel like we're in control. And when you are attracted to holistic or integrative medicine, it's because Western medicine has failed you and you want to find some kind of control. And so we all get here usually kind of by this similar path in that we care about our animals, we've been failed, we feel failed by the Western medical system, which I mean I agree, like it's too limited. That's a whole nother episode. But then we think that if we make all the right decisions, we are going to, with 100% certainty, affect the outcome of our pet's life. They're not going to have any
mm.
problems. They're not going to have cancer and they're never going to die.
Oh, and
And
that's when we hear the saddest it always breaks my heart when someone enters an appointment and their dog has cancer or their dog has some devastating diagnosis, and what comes out of their mouth is, "I did everything right. Thought I did everything right."
right,
And it's just, again, that cloak of shame that we as an industry, when we make those statements, put on them.
right. And it's simply not true. There's no one variable that's going to cause your dog to get cancer or not get cancer except for their genetics. And yes, we are like learning we can turn genes on and off, and that is great. But if you have a golden retriever or a boxer, you are fighting the uphill battle of cancer. And I think so many people blame themselves when it inevitably happens. And they think that there's something they should have done. They failed their pet. And I think it's just a fancy way for people to consume maybe different diets like get different diets for their pets or buy the supplement. And I think when people sell with fear and shame like that, it's just a fancy way capitalism is stealing time you have to be happy with your dog.
Mm.
And as
So
someone,
around diet, knowing that you're so passionate around diet, what is the more responsible statement?
I think the more responsible statement is to feed the best diet that you can. and that your dog will eat. Picking the diet for your dog is so complicated. We don't all have the means to feed 3 50-pound dogs an exclusively raw diet that has been sustainably sourced. And, like that is
No,
not,
that is a mortgage payment.
that is a mortgage payment. And some people do it, and I am so happy for them and their dogs. I do think when dogs and cats are fed a better diet, they have less health problems. And I think we see better outcomes overall, but not always. And it's not the only variable. But just because you can't feed your 50-pound dog an all raw diet, you can't afford all Stella and Chewies every month all the time, doesn't mean that your dog is going to die of cancer.
Right.
It's just not how this works.
But fear will keep people buying and
Fear
keep
will
people subscribing.
And I'll tell you, after working with Stella and Chewies, they don't want you to feel that way either. And they're so passionate about meeting people where they're at that they've created all these lines of products. They're like, okay, you can't always feed raw. Here's a raw topper. Okay, you can't, you need some kibble. Here's kibble with a little bit of raw. Here's kibble with no raw. Like, it's so important to meet people where they are. And just
Well,
because you can't
yeah.
feed that raw diet doesn't mean you shouldn't have a dog or that your
No,
dog's going to die
no
of
way.
cancer.
No. And on top of that, I think the and I'm going to keep using the word rhetoric, but making those blanket statements has created, how do I say this? The keyboard warriors. So when someone maybe responds to this episode, there will inevitably be somebody who says, well, feeding kibble gives your cat cancer. There's an army of people saying it.
Yeah. And I wonder what they think they're doing to help. I mean, I hate kibble for cats for so many reasons.
Right.
But I don't think that shaming people is the way to go. Just
No, and it starts from the top down. So that's what I hear you saying is we have a responsibility as professionals in the holistic space to be really responsible with our language.
yes. Because I think we're stealing happiness and time from people and the dogs that could be enjoying each other and not fretting. Like, I would say after almost 20 years of practice, what I want to tell people, do the best you can. Please enjoy your dog. We don't get them forever. Like, this is all temporary. You don't have to worry that every decision is the right decision. Love your dog and let your dog love you.
Right. And you're saying dog, and I think it really has been dog guardians, but we have moved into a space where cat guardians are now experiencing this as well.
Definitely. Yes. And
Yeah.
enjoy your cat. Your cat doesn't want you to stress out about
No.
feeding them everything perfectly. And honestly, your cat's making a lot of their own medical and life decisions.
Right. We always come back to that. Like,
Yes.
you may want to do this, and your cat's going to have none of it.
Yes.
They are the
Yes.
ultimate deciders of their fate.
They really are.
Okay.
Okay, so this is my last one. But if you're going to follow a holistic veterinarian, if you're going to listen to a holistic veterinarian, just consider how much time in practice they have spent. How many years as a general practitioner, or even, any kind of practitioner, maybe they're an oncologist or whatever, like maybe they're a specialist. Consider that, because I'll tell you that there are a lot of things that people recommend to heal the gut, or to use Chinese herbs for everything, or there's just a glandular supplement that's going to clear everything, or if you just switch your pet's water to filtered water, that everything's going to be okay. And this is like a massive component of your pet's disease. In practice, that just doesn't really pan out. I remember when I first learned Chinese medicine and I was learning herbs, and Steve Marsden, who's a brilliant veterinarian and just the smartest person. He's also like a human, probably, I don't know if he's an osteopath, but he's an acupuncturist. And anyways, he's amazing. And he always made me feel like I could cure anything with Chinese herbs. And so I like go back into practice. And it turns out you can't. You can't. Like, when I have a really itchy dog that has food and environmental allergies, there's no herbal formula that's going to make that better. And raw diets don't, in fact, fix everything. And so really consider how long that veterinarian has spent managing case after case after case, year after year, because I think that has helped inform my practice of what works and what doesn't work. Like I know for urinary incontinence, I know I'm going to be pretty successful with my herbs. I know with my autoimmune conditions, I can be pretty successful with the way I use herbs. Of course, I'm going to use steroids too, but when I'm weaned down on steroids, I'm gonna have a better outcome when I do use my herbs. Using herbs alone for itchy dogs is like pissing in the wind. Like it's
Right.
not gonna work because you didn't take away the allergen and you didn't take away the immune response. The other thing I'll say is I don't care how much gut healing you're gonna do with probiotics and whatever, it's rarely gonna be enough. It's
Yes.
just
That's a good one. I'm glad you said that one. I had that one in the back of my head.
yeah. I mean, yeah, no, we do need to heal the gut, but not in necessarily in the ways you think. And so anyways, just check on that veterinarian. How many cases have they managed in person over the years?
Right. I like to refer to that as for my life. Those are lessons in empathy. Anytime I think something so strongly and am shown something on the opposite side, I feel I gain a deeper empathic response for both sides of the equation. And so I feel like we can approach veterinary medicine in that way. There's always a both and, right?
Yes,
There's not one right and one wrong answer. There is a whole spectrum of fits, if you will.
absolutely. And I will say, going back to Steve Marson, he probably can cure anything with herbs. He's probably just a way better practitioner than me. But I think overall, just keep looking for that experience. And you're right, the empathy, those sweeping statements are red flags. If your veterinarian won't work with you unless you feed or give filtered water, it's a red flag.
Right.
That's all
And
I'm
on the
gonna
flip
say.
side of that, if your veterinarian won't work with you because you feed a raw food diet, also red flag.
Also a red flag.
Yeah.
That is so true. So those
Okay.
were a lot of icks about holistic medicine that I've had over the years that I
How do
had
you
to
feel now
share.
that you said them out loud?
Well, I know I'm gonna get some backlash and some of it's probably gonna be misunderstood and that's okay. I can clarify. Did I say anything that you think is gonna be misunderstood?
No, I thought you were very PC and
Okay.
really, yeah, not calculated because that feels manipulative, but very conscious in the choices of words. I didn't hear any slamming. I
Oh,
think,
good. Okay.
yeah, no, I think it's what you're bringing to the table is important for people to look beyond what feels urgent or, yeah, anything that's being sold in fear is probably something to look underneath.
Yes.
And if you did, we'll hear about it.
We'll hear about it. I'll have a chance to clear it up. I'm so sorry if I've made any sweeping statement. Of course, like we don't have time to go into to everything. And
Right?
maybe
I'd
I'll
be curious what people have heard too in their clinics or in the or what they've bought into that maybe they've changed their mind on as they've gone years into their pet parenting journey.
definitely, definitely. Yeah, I think that people will have some good feedback. So we want to hear your feedback. Leave a comment, even if it's not favorable, but do give me a chance. You can come at me if you want, but like give me a chance to either clarify or explain myself, or maybe you can just come at me and there's no clarification. Maybe you'll agree with me, and maybe you're a holistic veterinarian that can cure anything with herbs and you can teach me more stuff. I'm open to that too. Maybe you're
Right?
gonna come in my comments and be like, hey, actually, Angie, I can cure any itchy dog with Chinese herbs, and then I want to be your best friend.
I was
And
gonna
I
say,
want,
then we want to know that protocol,
yeah,
right?
I want to know it all. Like, give it to me. And so we'd love to hear from you. And if you're listening and you're interested in learning more about an integrative approach to various diseases, you can go to boulderholisticvet.com. We have some pre-recorded courses about vomiting cats, vaccines, itchy dogs, and you can get one for free using the code Truth Tales. Did I say it right?
You did.
Truth Tales.
Nicely done.
And you can spell it either way. Is that still true? TAILS
Yes,
or
that's still true.
TALES?
Yeah.
So,
And I would also like to throw in there too, this is a great time to mention that Dr. Angie does do consultations. And so if you are feeling overwhelmed by the information you've been given by your veterinarian or the information that you're seeking and not getting from your veterinarian, Dr. Angie does offer online consultations, which can be booked through our website as well. You'll see book a consultation, and that's a great place to piece through what you've been given in terms of information, where you want to go, and help create a care plan that feels aligned for you and your pet. So,
Yes, I love consultations. I love our Zoom calls, and it's all recorded, and so
yeah,
you can take
bust
the
some
recording.
myths. Yeah, you can bust some myths in those conversations. So,
Yes.
okay, that
Okay,
is
we'll see you
all.
next time.
Bye.
Bye.